X-rays are one of the most common tools in modern healthcare. In this video, you'll see what they are, how they make images, what ionizing radiation means, and how safety keeps patients protected every day. To understand X-rays, it helps to start with energy. X-rays are part of the electromagnetic spectrum, the same family as radio waves, microwaves, visible light, ultraviolet light, and gamma rays. These forms of energy differ mainly by wavelength and frequency. Radio waves sit at the low energy end, while gamma rays sit at the high energy end. Visible light is the tiny slice our eyes can detect. Just beyond violet light is ultraviolet, and beyond that are X-rays. What makes X-rays special is their much higher energy compared with visible light. That extra energy gives them the ability to travel through soft tissues inside the body. Different tissues slow or absorb X-rays by different amounts, which is exactly what makes imaging possible. So when you hear that an X-ray uses radiation, it means it uses a very energetic form of electromagnetic energy to look inside the body without surgery. Now let's look at what ionizing radiation means. Matter is made of atoms, with a nucleus in the center and electrons moving around it. If incoming energy is strong enough, it can knock an electron away from an atom. That process is called ionization. X-rays have enough energy to do that, which is why they are called ionizing radiation. By contrast, lower energy forms like radio waves, microwaves, and visible light are non-ionizing. They can carry energy, but they do not typically remove electrons from atoms. That distinction matters because ionizing radiation can interact with living tissue at the atomic level. In medical imaging, that doesn't mean X-rays are unsafe by default. It means they must be used carefully, for the right reason, and with the right technique. That's why radiation safety is built into every justified exam, from how the image is planned to how the dose is kept as low as reasonably achievable. Inside the X-ray tube, the process starts with a small filament that heats up, a lot like the element inside a light bulb. As the filament gets hot, it releases a cloud of electrons. Those electrons are then held ready for the next step. When high voltage is applied across the tube, the electrons accelerate at tremendous speed toward a metal target, usually made of tungsten. When those fast-moving electrons strike the tungsten target, their energy is suddenly converted. A small fraction becomes X-ray photons. Most of the energy does not become X-rays at all. It becomes heat, which is why tube design and cooling are so important. The X-rays that are produced leave the tube through a controlled opening, and collimators shape the beam so it covers only the area that needs to be imaged. That shaped beam passes through the patient, where different tissues absorb different amounts of energy along the way. On the far side, a detector captures the X-rays that make it through the body and turns that information into a signal the system can analyze. From start to finish, the machine is really managing energy. Heat is the main byproduct, and carefully controlled X-rays are the useful output. That balance is what lets an X-ray system create a useful image while keeping the process efficient and tightly controlled. An X-ray image forms because the beam doesn't pass through every part of the body in the same way. Dense materials like bone absorb more X-ray energy, so fewer X-rays reach the detector behind them. Because fewer X-rays arrive there, bone appears bright or white on the final image. Soft tissues absorb less than bone, so they usually appear in shades of gray. Air absorbs the least, which means many more X-rays reach the detector. That's why areas filled with air, like the lungs, look dark or black. The detector measures these differences in intensity across the image area. Then the computer processes that information into a digital image that radiologists and clinicians can read. So, the picture is really a map of how much X-ray energy was stopped or allowed through by different tissues. CT, or computed tomography, uses the same kind of ionizing radiation as a regular X-ray. The difference is in how the information is collected. Instead of taking a single projection image, a CT scanner rotates around the body and gathers X-ray data from many angles. A computer combines that data into cross-sectional images, often called slices, which let clinicians look inside the body layer by layer. Those slices can also be assembled into three-dimensional reconstructions, giving a clearer view of anatomy, injury, or disease. CT is especially useful when doctors need fast, detailed information about things like trauma, stroke, lung disease, or complex internal structures. Because CT collects so much information, it generally uses more radiation than a standard X-ray exam. That's why every CT exam is justified for a medical reason and optimized, so the dose is appropriate for the question being asked. Ionizing radiation is used across several imaging specialties, each designed for a different clinical purpose. General radiography is the most familiar. It includes common exams like chest X-rays and imaging of bones and joints. CT adds fast cross-sectional detail when a single X-ray image is not enough. Mammography uses carefully controlled X-rays to image breast tissue with high detail. Fluoroscopy provides real-time moving X-ray images, which can help guide exams and procedures. Interventional radiology uses imaging guidance during minimally invasive procedures, helping physicians treat problems from inside the body. Across all of these areas, technologists do far more than press a button. They care for patients, position the body correctly, choose or follow the right protocol, support image quality, and keep safety at the center of the exam. Radiation safety in medical imaging is built around a simple principle called ALARA. It stands for as low as reasonably achievable. The first step is justification. An exam should be performed because it is medically needed and likely to help answer an important clinical question. Next comes optimization, which means adjusting the exam for the specific patient, body part, and diagnostic task. Careful positioning helps avoid repeats. Precise collimation limits the beam to the area of interest. Modern digital systems can help produce excellent images efficiently, reducing unnecessary exposure compared with older approaches. Dose monitoring tools let departments track performance and compare exams against expected ranges. Quality assurance programs check that equipment, protocols, and image quality stay consistent over time. The goal is never zero information and never unnecessary dose. It's the lowest reasonable dose that still answers the medical question well. A common myth is that any amount of radiation is automatically dangerous. The reality is more nuanced than that. In medicine, imaging exams are not supposed to be casual or random. They are ordered for a reason, based on symptoms, history, and the need for accurate information. When an exam is justified and optimized, the expected medical benefit usually outweighs the very small potential risk from the radiation involved. That's why the conversation isn't simply radiation equals bad. It's whether the right exam is being done for the right patient, in the right way, at the right time. For patients, that means medically necessary imaging is part of careful care, not something done without thought. X-rays entered medicine almost immediately after Wilhelm Conrad Röntgen discovered them in 1895. One of the first famous medical images showed the bones in a hand, along with a ring. Early systems were slow, limited, and far less refined than what we use today. Modern digital imaging can produce detailed images quickly, with much better control and generally lower doses than earlier generations of equipment. X-rays help clinicians see injuries, disease, and internal anatomy quickly and non-invasively, which is why they remain such an important part of modern healthcare. In our next episode, we'll look at ultrasound and how it creates images without ionizing radiation. If you found this helpful, like the video, subscribe to the channel, share it with someone curious about medical imaging, and leave a comment with what you'd like us to cover next. Thanks for watching In the Know Medical Imaging. And if you'd like to keep learning, watch the next video on your screen. Please like, comment, and subscribe for more information.